Hi everyone, I'm Bonnie Coyle, the Public Health Director at Cabarrus Health Alliance, here today, Wednesday, September 30th, for a COVID update. As you can see here, we're at over 4,000 cases as of today, at 4,046, leaving us with about 401 active cases. We have about 3,573 people who are recovered. We have 22 residents of the county currently hospitalized, and we are at 72 deaths. What you'll notice here as you look at our total cases, the yellow line will show us the 7-day rolling average. And I want to point out the little concerning trend that we are seeing starting around September 18th, where we are starting to see an uptick of cases, which coincides with about 2 weeks after the Labor Day weekend and celebrations and things that may have happened as a result. We feed down and we can look at just one or two more slides. This slide shows you our total hospitalizations, and they are continuing to drop. And then this next slide shows the tests that we are doing in the county. You'll see that we are really staying up there with the total tests we are doing to make sure that we are finding people who have COVID and then able to do the contact tracing to prevent the spread. Again, a little bit of a concerning trend here is that as of this past week, we are starting to see a little bit of a trend up in our percent positivity. We had gotten down to about 5.4%, and we ticked up a little bit to approximately 6.6% this past week. So we're keeping an eye on that. Hopefully we're going to see that level out again. I would also like to take an opportunity today to provide a little bit of clarification about the role of the Cabarrus Health Alliance in the COVID pandemic. There's some confusion amongst our community about what we do. First and foremost is the health and well-being of our residents here in the county. The Cabarrus Health Alliance has the duty and the responsibility to take certain actions during a public health crisis like this pandemic to protect our residents. Some of the functions that we take care of are we do the case investigations for individuals who develop COVID infection. We do contact tracing for individuals who've been exposed to individuals who are infected. We do public education, and we monitor data trends to understand what is happening in our communities. We also help individuals, the public, and elected officials understand the governor's executive orders and other requirements that the state and local government might put out related to the pandemic. And we help individuals, local elected officials, and the community in general understand the data and provide education to them. One of the roles that we do not have the authority around is approving or not approving plans and dictating whether or not businesses, schools, other organizations can open or must be closed. Our role is to provide guidance and education to individuals who may be needing to make those kinds of decisions, but we do not have the authority ourselves. We also don't have the enforcement role. That is actually law enforcement that would enforce. So we want to work with all members of the community, all organizations, all businesses, to provide them the best possible information to make the decisions that they need to make to protect the health and well-being of the residents in the county. We invite all of you who have questions or concerns about the pandemic and our role to contact us directly so we can have an open conversation about our role and how we can best educate you and provide information that will help all of you in deciding how you manage the COVID pandemic and issues of concern to you. Thanks.